I don't think anyone can predict what is going to happen. If containment doesn't occur, if in fact this disease spreads regionally and globally, we still don't know what proportion of people will get it, nor do we know precisely how many of them will get severely ill. There's much more information we need today to be able to fight the epidemic today and tomorrow. What we do know is that we have to be prepared.
So what's the most critical information that we need right now?
I think there are several things that are really important to know. The first, we need to know much more about how the virus is spreading in communities and in healthcare facilities. That's crucial to know how to confront it.
So your article points out in times of crisis, the communication principle should be first, be right, be credible. Can you show us how that worked during the Ebola outbreak?
Be first, be right, be credible is the essential ethic of how to work on risk communications in an emergency. Be first, be clear about what you're saying. Tell them what you know, when you know it, how you know it, and what you're doing to find out more. Be right, get that technical data. Have the world's best experts understanding what's there, and be credible. Say things that people are going to be able to believe because they're true. And in Ebola, we were able to dispel certain rumors. I can remember times when there was great fear because it was said, oh, this is a virus that's mutated and it's spreading in airborne form. That wasn't true. We were able to show that wasn't true. Or that there were examples of people saying, oh, this is a virus that is spilling over from multiple animal importations. That also wasn't true. We were able to show that wasn't true. But perhaps even more importantly, by communicating effectively with people, we were able to change behavior. Get people to stop shaking hands. All throughout West Africa, for years, people used an elbow bump to say hello to each other. It's much safer than shaking hands in the middle of an epidemic, and to get people to rapidly seek care if they were ill.
We've seen a global shortage of medical supplies in this outbreak. Should countries and individuals, companies be stockpiling for times of crisis?
If this becomes a moderately or very severe pandemic, supplies are going to be a problem. And that means that for individuals and families, it's important, if you have a chronic disease, to have several months of medicine on hand. That's good practice in many cases. Also for businesses, it's important to be able to plan for how you would operate for many months if 40% of your staff or your workers were out sick or quarantined. So there's a lot that we need to do to prepare for a severe pandemic. What we hope won't happen is hoarding of supplies. There are things that can be done that are sensible. You can use a scarf or other thing to cover your mouth. You can wash your hands with soap and warm water. You can stock up on hand sanitizer if there is sufficient. There's a risk here. If people stockpile, there won't be enough for people who need it most. And that's particularly important in the case of masks.
Right now, we're treating the outbreak like a war, but then we have a tendency to forget in peacetime. How do we ensure we have the same spending urgency and generosity for infectious disease as we do for defense?
That's a crucial question. That's probably the single most important lesson we need to learn from this epidemic. What we see over and over is a cycle of panic and neglect, where in the midst of an epidemic, everyone is concerned. When it goes away, it goes out of the headlines and we stop focusing on it. Here's the bottom line. It would cost about $1 per person per year in lower income countries to drastically reduce the risk of an event like this happening in the future. That may be $3 or $4 billion a year. That's a lot of money for public health. It's a tiny fraction of what this outbreak is causing. And the next outbreak could be much worse. So if we don't invest substantially in disease detection, prevention, and control systems in Africa and Asia, where they're weakest now, shame on us, because we will be at higher risk. We hope that this will be a wake-up call for the world to invest in a sustained manner. This isn't a 1 week or 1 month or 1 year effort. This is a 5, 10, 15, 20-year effort to build the equivalent of fire alarms and sprinkler systems for emerging health threats around the world.